Hello, welcome. My name is Daniel Branco. I'm the host of the Entrepreneur community. And today I'm going to speak with Mike Kijewski about entrepreneurship of radiation therapy or entrepreneurship in the radiation therapy space. Let me just bring Mike on board. Just a minute.
Hey,
Okay.
Daniel.
Hey, Mike.
Thanks for
Good to
having me.
see you. Yeah, sure. Thanks for being here. It's great to see you again. So let's get this started. This is going to be our. Am I cutting out a little bit or
No, you sound great.
sound right? Okay. So this is going to be our live on. What is the best way to put it? Like I've been calling this the entrepreneurship on the radiation therapy space or software for medical devices. Is that a good
Yeah.
way to put it? You think?
Y- Yeah, absolutely. Yeah, I've been working sort of, I wanted to get as close to working in medical devices as possible without having to ever go through a 510K process myself. So yeah, so that's sort of the
Oh,
theme of my career trajectory.
that's an interesting strategy. That's interesting. So did you come up with that like beforehand, or did you happen to just find yourself in the, like following that kind of strategy? Like, oh, I'm not going. I don't want to like go through the entire regulatory path of a medical device, but I want to be part of the scene or part of that space, right? So that's pretty much how
Yeah.
it started.
Yeah, I think a lot of it came out of necessity. So my personal background is in medical physics, which is the science behind radiation oncology. I was a
Uh-huh.
graduate student at the University of Pennsylvania, studying on a career path that would have otherwise put me in the basement of a hospital, helping to create radiation oncology treatment plans for primarily cancer patients. But at the time, I had an idea for a product that I thought would make the lives of medical physicists working in this space a little bit easier. So I started a company around it, started building a prototype of the software. And to say that I started a company around it is a bit of an overstatement because at the time I knew very little about entrepreneurship, how companies should work, the process of actually getting something to market. With that company, we ended up raising about $300,000 in seed money from a couple of angel investors. And didn't really know what I was doing, didn't have a ton of capital. So to think that, hey, with $300,000, I'm going to build some product that's going to go through a regulatory approval and get to market really wasn't in the cards. But I was very interested in the medical device space, very interested in radiation oncology. Essentially, I said, what kinds of things can we build that would be very helpful in the medical device space, but that themselves wouldn't require, a regulatory approval. And I
Right.
sort of looked at, there's
That's
this.
Gamma Basics. That's the company.
Yeah, Gamma
Yeah.
Basics. Yeah, yeah. So, but before I went into grad school, I worked for a company that built radiation oncology facilities. So they'd go into the hospital and they'd build the radiation shielding needed to put a radiation therapy system in the basement of a hospital. And my job was to figure out how thick the concrete shielding needed to be. And the answer to that question varies depending upon what device you're putting in the basement, how much the basement of the hospital is occupied, and the answer can be anywhere between 3 feet and 10 feet of concrete. And as you can imagine, pouring a wall of concrete that's 10 feet thick,
It's a
it's
lot.
a
I
lot of
remember
material.
I was part of a project of like installing a cyclotron in a
Mm.
hospital, like in the basement of a hospital, and like the amount of concrete was like huge.
Yeah, it's exactly that process, right? So my job was to figure out how much concrete needed to go in there. And I remember when I started working at my employer, they said, your job is to calculate how much concrete we need. And I said, great, what software do we use to do it? And they said, Microsoft Word, not even Excel, Word. I'm like, what do you mean Word? Like, well, here's the equation. And then I use my calculator and I do the math and I get an answer. And I remember just making a note at the time, like, hey, this seems like a process for which there should be dedicated software. So when I was a grad student at Penn, we started, my co-founders and I started building that software. And I didn't, I was not experienced enough in entrepreneurship to have asked the question, how big is the addressable market? What barriers are there to getting to entry? What sort of competitive moats are there? It was just like, hey, I had this job and I was using Word to do it. There should be some specialized software. So we started building that software. And what I realized, while going through the process
To
of,
calculate the amount of concrete. Is that the software you're talking
yeah,
about? Okay,
exactly.
so
Yep.
that's how it's. Uh-huh.
Yeah, a software application called GrayCat. And I had two revelations while running that company that I think are relevant to other people who are looking to make the transition from being a scientist to being an entrepreneur. So the first is if we can build software, build sort of picks and shovels that are useful in this gold rush, right? We can sell tools to medical device manufacturers, or in today's market, to companies that are building AI-based, software for use in healthcare. We have a higher probability of success, even if our total addressable market is smaller, right?
Right.
So if you do the math as an entrepreneur, and one of your goals is to make a couple bucks while doing this, not the only goal, but one of the goals, you could dedicate your life to finding a singular cure for cancer. And if you do that, by all means, you're going to have a tremendous impact on humanity, and likely a very good financial outcome as well. But the odds of any one person finding a singular cure for cancer are low. If you were to build a testing platform that would allow all of the drug companies in the world looking to find a cure for cancer, give them a way to do their job more efficiently, you have a higher probability of success. You're probably not going to make quite as much as you would if you were to find the cure for cancer yourself, but you have a high probability at a maybe slightly smaller outcome. And I really liked the odds on that. The other observation I had is that I wasn't maybe the best medical physicist. I wasn't the smartest person in the room by any means, and I was certainly not the best entrepreneur. But if you can be in like the top 20% for your field in science, and the top 20% in understanding business, well, all of a sudden you're in the top 4% of people being entrepreneurial in that space. So I really like the idea of trying to combine a scientific understanding of a specific problem with the business acumen to actually execute on it.
I think I've had kind of the same sentiment. Like I was a neuroscientist, and I wanted to dedicate to entrepreneurship, and I was in academia, and that was something that I had in me. Like I wanted to do that, and I think part of the insight was that, well, I think I'm good enough at this, but I'm not sure this is going to be like the ultimate accomplishment, or I'm not sure I'm going to be able to like really excel at this field. And then I thought maybe it's better to be very good at several different things than be like excellent at just one thing, one little thing. I had the feeling that I was getting so much specialized to the point people couldn't even understand what I did or what is right. Is that the same kind of feeling you think?
Absolutely. Yeah. I mean, I remember being a master's student in medical physics, and the two paths I was considering were, I could go to a PhD and do basic research in this space. There are a lot of smart people who were, smarter than me and more accomplished than I was in that space. Or I could go the business route and try to help bring some of these new innovations to market. And I remember asking my program advisor in the physics department if I could take my two electives that I had and apply them to healthcare entrepreneurship courses in the business school. And they thought, well, that's really weird. No one's ever done that before, but I guess you can. And I remember thinking, if this is really weird and nobody has done this before, it's either a really good idea or a really bad idea, but we're going to find out one way or the other. And it turned out to be a really good idea for me. So I ended up taking those courses, doing an MBA, and I found that, I was maybe the least, the least quantitative person in my physics program. Like the math was really hard. I really had to work very hard, to then going into a business school program where I was one of the more quantitatively talented individuals. So I was sort of, a bigger fish in a smaller pond, at least as it came to like statistics or mathematics. But man, there was a whole lot of stuff around how business actually works that was entirely new to me. So looking back on it, I ended up doing 2 master's degrees, and I have the student loan debt to prove it. But for me, I don't think I would have been very successful being a PhD in medical physicist. I'm, again, not the brightest physicist. And had I just done a business undergrad and gone to work in, healthcare business without an expertise in the science, I don't know that I would have been particularly successful. Any success that I've had, I think, has come from that overlap of being pretty good at the science behind radiation oncology and pretty good at the business part, and the overlap, it was really helpful.
Nice, very nice. So yeah, it seemed like you had the clarity like early on when we were in academia that, well, maybe uh, business development would be a better fit. So do you think you have like a you're mentioning that you were the one with the least how did you put it, technical skills, not technical, like
Yeah.
hard skills. So did you feel more like a soft skills person in a very technical environment, or
No, maybe I'll say it more directly. There was 11 people in my master's program in physics. I was
oh.
absolutely the dumbest person out of those 11. And that's not
Okay.
me being modest or like hyperbole. As you might imagine, there's some very smart people that go into graduate physics. And
Yeah.
I remember there was one course that I took called the mathematics of medical imaging. So
Okay.
CT scans are based on this idea that there's a mathematical algorithm you can apply to a group of single X-rays. And based on this algorithm, you can create a three-dimensional representation of what's going on inside the body. And one of the mathematical functions you need to be able to do is something called a Fourier analysis. And I remember doing these Fourier analyses by hand and
I remember
realized
those.
I had reached the limit of my mathematical ability. I mean, my brain does not. It's like if you go to yoga and they're like, "Hey, put your legs behind your head," I'm like, my legs don't go behind my head. I could not do Fourier analysis by hand. So out of the 11 physics students, I got the lowest grade in this mathematical imaging course. However, the other half of the class were all med students. And these were students who, presumably were also smarter than me, but they hadn't spent years and years doing physics and doing mathematics. So I got a lower grade than any physics students, but a higher grade than any med students. So that put me right in the middle. And that's sort of like the summary of my career, right? If I can be right in the middle between a group of physics students and med students, I'm very comfortable in the middle there.
That's very interesting. Yeah, I've been through like a similar path. Like I went to engineering school, finished the math courses and physics courses at engineering school, but at some point, like in the end, I was thinking, well, this is kind of too much for my brain as well.
Yeah.
And then, but when I went to medical school, I was pretty much in the same situation. I was like the most technically savvy person in the room, developing software as well for brain mapping, and ended up doing a PhD and a postdoc in brain mapping for epilepsy surgery planning, which was very interesting.
Wow.
But yeah, so yeah, I know the feeling. Like, so in a sense, I think that people like us, we end up working as bridges, like connecting two different worlds. Like in your case, the medical physics world, actually the physics world with the medical world, which is medical physics, right?
Yeah. That's a great way to look at it, being a bridge between those two fields, right? I mean, if to those people listening to the podcast, if they're scientists thinking about going into entrepreneurship, if you are the best scientist in your field, you might want to keep doing whatever you're doing today and be the best scientist in your field. But if you're somebody who can really understand two different hills, right? You understand the science hill of whatever field you're in, and you understand the business hill of how they're applied. If you can be a bridge between those two, that's a very important and potentially lucrative role to play.
So how was how did the Gamma Basics story develop, and how did it end? Because it ended, right? Right now you are like a running MedCrypt. So can you tell us a little bit of that story? It started with like a $300,000 investment, and then how did it go?
So a couple of there are so many. I learned so much from that process, and even had Gamma Basics not been financially successful, I believe I would have been very happy that I gave it a shot and tried it, because I really learned so much from the process. In short, we hadn't raised any money from investors, and I saw a University of Pennsylvania alumni, whatever the singular of alumni is, come to campus to talk about his experience starting a business when he was a student, and now the business was very successful. His name was Greg Bentley, and he ran a software company called Bentley Systems, which did some computer-aided drafting software. And I remember finding his email address somehow, emailing him directly and saying, "Hey, I'm a student. I'd love to tell you about what I'm building and get your advice." And the short version of the story is he met me for breakfast. He invited me to his office. And I didn't even ask for an investment. At the end of our meeting in his office, he said, "Are you raising money?" And I said, "Sure." And he said, "How much do you need?" $100,000. And probably didn't work out this way, but in my head, I left that meeting with a check, a handwritten check for $100,000, which is more money than I'd ever seen ever. And Greg played a really important role, and I learned so much from him supporting our company. And he ended up making 2 investments, one for 100,000 and then a subsequent one, I think for 200. On top of that, my father put in, I don't know, either $10,000 or $20,000. And then one of my professors at Wharton, Gary Kurtzman, a whole funny story about taking his healthcare entrepreneurship class, but he ended up making an investment in Gamma Basics as well. So I think we raised in total about $325,000, which was enough for us to build the product, get our first customers, sign a couple of deals. And then about 18 months after finishing business school, is that right? 18 months? Yeah, about 18 months later, we sold the company to Varian Medical Systems, a big radiation oncology company.
Wow.
In retrospect, I look back on it and it was a successful exit, and we turned, a couple $100,000 into a couple million, which was more money than I had ever, seen as a former high school physics teacher. But our success was not guaranteed. We came really close to running out of money at the end, and had the deal with Varian fallen apart. I'm not sure how things would have worked out. But I ended up getting to spend 3 really great years working inside Varian, helping manage the products that Varian acquired from us. And that was also a really great learning experience. But if you're somebody who's working in the lab, or you're working as a scientist, you're a grad student, and you have an idea for a product or service, I think that there are a lot of people, a lot of scientists in particular, who feel like there's some level of credential you need to have, or some level of permission you need to get in order to start a business. From my personal experience, I can assure you that is not true. Just start it, and if worst case, it'll be a really great learning experience.
I think it comes more to believing in yourself and believing that you can do it. So then other people follow you. Like it's more than credentials or anything more specific, right?
I hear what you're saying, but I don't remember when I was in grad school really believing in myself per se, and that might sound weird. I didn't have this position that, like, oh, I'm going to be successful and this business is going to be successful. I really approached it more as an experiment. Like, hey, I think this product should exist. I think this solves a problem that's in the market. How can I test that hypothesis? And I kind of broke a much larger problem into smaller steps. And if I can get somebody to pay me for this, then maybe I'm onto something. I remember our very first customer was a physicist working at a hospital in the Netherlands at Erasmus Medical Center. His name is Dennis Grafsmid. Dennis, in the unlikely event that you're listening, thank you for being my very first customer for any of my companies. And they paid us, I think it was like $10,000 or something, to use the software to do an analysis of shielding. And I remember thinking, oh, okay, maybe there is something here. And then we got Varian as a customer, and they're sort of the biggest company in the space. And okay, if Varian's willing to pay for this, maybe there's something here. And we just continually did experiments until at the end, Varian ended up buying us and ended up being successful. But if you're somebody who maybe doesn't feel super confident in your own ability to be successful, that doesn't necessarily disqualify you from starting a business, because you can treat it like an experiment, and you can have realistic expectations for the outcome, but give it a shot, and it can still be successful.
I think this is a great point, because if you start like usually believing in yourself and having like a building, like, no, I can do it. It comes from a place of like hardship in a sense, because you have to believe in yourself to make it work, because it's so hard, right? If you don't believe in yourself, you're not gonna make it. So yeah. I think this is a great take, like face it more like an experiment, and perhaps without as much expectation, like right, as so whatever happens, if you treat it as like an experiment, whatever happens is going to be good. Like you mentioned in the beginning, even if it didn't go financially as well as it did, you'll be happy doing it anyway.
Right. Yeah, I mean, I think that's probably maybe a way to restate what you just said is, in order to start a business and be successful, you must either, number one, be really confident in yourself that you'll be successful, or number two, be willing to fail. And I know that scientists who do experiments, it's very unlikely that every experiment you ever do is going to be successful, however you define successful. But you give it a shot, you collect some data, you come back and you do it again. And that might be true. That might be a cycle that plays itself out inside a company itself. You might have several different experiments inside a company, or you can think about the company as itself, an experiment that may or may not be successful. I know that one of the things may sound a little weird, but one of the experiences from my childhood, which I think was very useful in becoming an entrepreneur, was growing up skateboarding. And I was an avid, but perhaps not really great skateboarder all through, starting in middle school, through high school, and then really in college and the years after. And for anybody listening who has ever attempted skateboarding or seen skateboarding, people try tricks hundreds of times before they land them, and you fail repeatedly. And one of the really interesting, maybe sociological things that I observed from skateboarding is that when you're skating with a group of other people and you attempt a trick and you fail, nobody laughs at you or says, oh, they're not good at skateboarding. They know it's part of the process, that you might try a kickflip down a set of stairs 100 times. And when you actually do land it, they're excited for you. So when I started Gamma Basics, I thought there was a pretty high probability we would not be successful, and that was okay, because I spent a lot of my childhood and my adolescence being unsuccessful skateboarding, and I was fine with that. So counterintuitively, a willingness to fail is a prerequisite to be successful.
This is such a great insight, because in academia it's usually the opposite, right? It's very hard for academics to fail, I think. The way I see it, like for most scientists and academics, they usually come from a sequence of successes, like academic successes, like they were like one of the top in class, and then they keep like climbing the ladder until they go through all of the masters, PhD, postdocs, and all of that. And that usually requires lots of successes in those and all of those steps along the way, right? So having the experience failing with someone, it's really important. I think I missed that a lot, like throughout my education. Like it was always very academic, but it's also limited. It's success, but also to a limited extent, because it's one thing being successful when everything depends on you, like your own effort, and that's very valuable, like being hard, like putting the hard work necessary to accomplish academic things and all of that. But when it comes to building a business, you start dealing with variables that are totally out of your control. Like it's not only about working hard and putting in the best you can and doing everything that you can. There's a lot of uncertainties involved in the process, like meeting the right people. For example, how did you get to connect with Varian? And like they became your clients. Like I guess you reached out to them like to sell the product, and then the relationship was getting deeper and deeper to the point they reached out, they approached you and made you an offer. How did that happen?
Yeah. So not nearly that linearly, right?
It never is, right?
Yeah. So I think it's touching on our theme here, being willing to fail. I remember asking 5 to 10 people that I was connected to through either school or my prior job, hey, will you make an introduction for me to somebody at Varian? And some of them wouldn't respond to my email. Some of them would and said, I can't really help you here. And I think 2 or 3 people ended up agreeing to make an intro. And one of them was a guy at the University of Pennsylvania who worked in the radiation oncology department. And his name was Jim McDonough. He played a really important role in my entrepreneurial journey, even though reluctantly, and I don't know to what extent he remembers this, but he made a connection to somebody at Varian and said, hey, I've got a student who's working on this radiation shielding thing. Can you direct him to the right person? And the person at Varian that I was connected to connected me to the right people inside Varian, and they were willing to take a meeting. And I remember, back to your point about there are things that are out of your control. We came to them and said, hey, we're building the shielding software. We think it would be useful to you internally or to your customers. And they said, yeah, this is something we've thought about, but we kind of have a tool already that does this. And you're some random 27-year-old grad student who is probably dressed inappropriately for this meeting. And I don't know, why would we want to work with you instead of somebody else? And we had these back and forths with Varian for probably a year. And there was not really committal to using the product. They thought it sounded like a good idea, but nothing. All of a sudden, it turned out that, as I recall it, and this may be inaccurate, One division inside Varian was ready to launch a new version of their medical device that the division we were talking to, who was responsible for the shielding, the software they had internally couldn't work with this new medical device. And all of a sudden, this became a burning issue of like, okay, this is a huge problem. We've got all these devices we're going to sell. We can't do the shielding for them. Let's call that crazy guy, the crazy grad student who called us and said he had an idea. And we ended up having a conversation where they said, this is like a hair on fire problem. We need to have this fixed. So, lesson number one is timing trumps pretty much everything else, right? So our product was the same at the beginning of our conversation as it was a year into the relationship, but it took a year for this to become a burning problem. And then number two, they decided to put out a request for a proposal to a bunch of different software people to fix this problem. And now I recognize that this is a very normal thing to happen. But at the time, I was kind of offended. Like, hey, we spent a year telling you about how to solve this problem, and now you're going to go put out an RFP and let some random people fix the problem. And I remember reading in a book, I think it was called The Challenger Sale, right? I think this anecdote comes from a very famous book called The Challenger Sale, where they put out an RFP that had a bunch of gaps in it from our perspective, things they hadn't considered. Right. So in our RFP response, we said, hey, we noticed there's 10 things you didn't ask for in the software that you absolutely need. Here are 3 of them. We're not going to tell you the other 7, but if you work with us, we'll be sure to fix them. We ended up getting that contract. And
the idea of like providing those 3 ideas, but not the other 7 came from the book?
Yeah.
Okay.
Yep. Yeah. And it sounds pretty obnoxious, right? But there were a couple of times where I did things that in retrospect or at the time felt a little obnoxious, but in retrospect, we wouldn't have gotten the deal done had that not happened. That was one of them, right? Saying like, hey, we understand this problem better than anybody. We're not going to teach you everything we know for free, but here's evidence that we know this problem better than even you do. And they ended up contracting with us and using the software. And then, to make a long story short, they were a customer for a year or 2. I had graduated from business school. I did not go and interview for quote unquote real jobs like my classmates did. I was just, running Gamma Basics.
Yeah, I saw that you were in the entrepreneurship major.
Yeah.
So you made a decision early on in business school to go this route.
Yes, or I was unqualified for any of the other paths, right? So I was not. I wasn't going to get a job at Goldman Sachs. I wasn't going to get a job at McKinsey. Entrepreneurship was really my only real hope. And I remember being in a meeting with Varian about 2 months after I finished business school, where one of the VPs in the room said, "So, like, what's your plan with Gamma Basics? Like, are you growing the business? Or are you doing whatever?" And I remember. Am I allowed to use modest profanity on this podcast? It's relevant to the story. I remember I told this guy like, hey, we're going to keep building cool shit until you buy us. And as soon as I said it, I'm like, oh my God, I'm just such a knucklehead. I shouldn't have said that. And I left the meeting feeling like I had just ruined the relationship with this company. I was sitting in the airport waiting to fly home, and that VP called me and said, I think you're right. I think we should buy you. And it took 14 or 15 months, but 14 or 15 months later, Varian actually bought us. And in retrospect, had I not said something that was wildly inappropriate at the time, maybe the seed would not have been planted in this guy's head and the deal wouldn't have happened.
Yeah, because in one way or another, you made it clear to them that that's something you'd consider or it could make sense for them also as well, right?
Yeah. Now, somebody who's an expert in mergers and acquisitions would tell you I played that entirely wrong and I could have gotten 3 times the money had I done it differently. And that's probably true. But at the time I was just like, hey, Varian is the best company in radiation oncology. I want to be part of what you're doing. My team and I have a unique skill set that doesn't appear to be, currently inside Varian, and we would love to be a part of the company. That's probably a more professional way to say what I initially said, but it worked out.
And then I saw on your LinkedIn profile that you stayed with Varian for a few years, right? After the acquisition. Was that like an acqui-hire process, or how did that happen?
Yeah, so most acquisitions of technology companies include some retention bonus for the founders. Like, hey, if you stay with us for an extra year, you'll get this check. And if you stay for 2 years, you get this other check. And I remember going into working at Varian thinking, I'm not really a big company guy. There's a good chance I'm going to make it like 6 months here and that's it. But I got inside Varian. It turned out it was awesome. Like I loved working at Varian.
Right.
Group of really smart people. Something like, I don't know, 50% of their leadership have a background in physics. So if nothing else, they're like-minded people, right? They viewed the world in a way not too dissimilar from how I did. So I really loved being at Varian. And had it not been for this opportunity with MedCrypt, I would probably still be at Varian working on something there. It's an awesome place to work.
How did that happen? Was it an opportunity that came to you, or was it something that came out of your mind, or like with
Yeah,
the MedCrypt?
it was an observation that, hey, there's for the scientists in the audience, I detected a system that was not in an equilibrium state, right? So I looked at a process that was being done around cybersecurity inside medical device manufacturers and thought, this isn't how this is going to play out 10 years from now. 10 years from now, this is going to be its own field with people who are experts in this space. And I remember looking around for people who were trying to become the experts in that space. And in 2014, 15, when I first had the idea for this, I didn't see any people or companies that were saying, hey, we think that healthcare requires its own approach to cybersecurity or its own implementation of cybersecurity. And I had a hypothesis that this was an opportunity. I tested it a bunch of different ways and was convinced that this was enough of a need that I wanted to start a business around it.
What is it again, Mike, that MedCrypt does? Is it it does cybersecurity to protect the devices, or what
Yeah.
is
So
the idea behind it?
yeah. So if you think of medical devices, things like pacemakers or surgical robots or X-ray machines, they're basically either very small or very large computers that perform some function to treat or diagnose disease. And most of those computers these days are connected to some other computer. And anytime two computers are connected, there's a chance that somebody could either change the data that those computers are passing back and forth to make the machine do something that's not supposed to, or could interrupt the function of the device in such a way that maybe the CT scanner isn't working today. And those are really, bad situations. And I think in 2014 or 2015, the consensus was, well, the CT scanner that I'm using runs Windows. A lot of times they run Windows, or they run a common Linux version. And there are software security tools for Windows and for Linux. Let's just put those on this medical device. But my observation and belief at the time, and continue to believe this today, is that the fact that this is a Windows computer it does not adequately describe how different the use case is from the Windows computer that's on your desk, right? So there's an anecdote about a cardiac monitor that was in use during a stenting procedure where somebody's putting a stent in some of the patient's heart. And either the cardiac monitor manufacturer or the hospital or somebody had put antivirus software on the cardiac monitor. And the antivirus software decided that it needed to update the software in the middle of the procedure, and it rebooted the cardiac monitor. And it wasn't available for, 3 or 4 minutes or something. That can never happen on a ventilator that's literally breathing for a patient, or a pacemaker that's making sure that a patient's heart beats correctly. So our observation was there need to be a set of security tools that can be used by companies building healthcare technology that place clinical functionality at the highest priority and take into account the usage patterns and regulatory requirements that medical devices and other healthcare technology devices have. And that's what we're doing at MedCrypt, building tools for companies building healthcare technology.
Very interesting. So in your first company, Gamma Basics, that was pretty much what the company was doing was very much associated with something that you knew how to do it. Like as a physicist, you know how to do those calculations, those concrete calculations, and all. And then now it seems like you're developing something which is a little bit out of your original background, or is it not?
Yeah.
How do you see it?
No, that's very fair. So I mentioned earlier that my first job in the healthcare space was working for a company that did radiation shielding, and it was my job to calculate the thickness of the shielding. I realized at some point, a couple of years into Gamma Basics, that I was probably the sixth most informed person in the world about radiation shielding, because there were 6 people that were exclusively focused on this, right? Okay, so I was last out of 6, but there's only 6 people that are really focused on this. I can be one of the top 10 people in the field by working in an obscure field. When we started MedCrypt I started really working on it in October of 2014. There were very few people that were exclusively focused on the overlap between medical devices and cybersecurity. And there were people working on the space as early as the early 2000s. So I by no means am the expert in the field, nor was I ever. But it was, there were probably 50 people that were exclusively focused on looking at the overlap between these two things in the whole world. So I'd like to think I was at least in the top 51 people in the space. So I'm a medical device person. I was not a cybersecurity person to start, but by being one of the earliest to look in this field, you sort of by default become, an expert, at least, key opinion leader as compared to others in the space. So back to that idea of I'm not the best and brightest medical device development person, certainly not the best and brightest cybersecurity person, but I've spent a lot of time looking at the overlap between those two areas. Not a ton of people who have done that, and therefore, I feel qualified to be able to innovate in that space.
So now, and then did you go the fundraising route again, like starting from scratch, building a team? How was it? How did you start it? How did you make the decision, or when did you decide to leave Variant to dedicate to this project? Was it already going on, or did you decide to leave Variant first and then get started with this, with more uncertainty?
Yeah, it was probably almost 18 months between when I first had the idea for this and when I decided I was going to leave Variant. And the short version is, I was looking for co-founders that understood the cybersecurity side of this problem better than I did. And I went through probably 10 prospective co-founders before I found a guy named Brett Hemingway, who's a professor of computer science, coincidentally at the University of Pennsylvania. I didn't meet him through Penn, but it just so happened that he had recently graduated from, I think, UCLA and ended up getting a professorship at Penn. And he's an expert in cryptography, not in healthcare, but I was, testing some of my hypotheses against him, and he seemed to think this was valid. And then we realized we needed a third co-founder who understood the actual implementation of software security into the medical device space. And the co-founder from my first company, Eric Pancoast, I had a group of co-founders for both Gamma Basics and MedCrypt, but Eric was the CTO of Gamma Basics, and I started to talk to him about this opportunity. And at the time, he was running a fairly lucrative and successful software consulting business. I didn't really think that he would be interested in doing this full time. Turned out that he was. So we kind of got the band back together, so to speak, with my co-founders from Gamma Basics and then Brett Hemingway to start MedCrypt. We thought that we needed $650,000 to get from zero to sort of the first milestone of the business. Mm-hmm. So we set out to raise $750,000. And I remember one of my mentors at the time said, "Raise $1 million. It just sounds sexier," was his term. And I'm like, but $1 million sounds like a lot of money. But we ended up circling the first $450,000 pretty quickly from people in our networks who we had met over the course of Gamma Basics, who had maybe started and sold businesses of their own. And we kind of got stuck at $450K. And I remember thinking that, okay, well, the worst case, Eric and I can pay ourselves to work on this full time for 18 months on $450K if we need to. So I told Varian in mid 2016 that I was going to be leaving. We ended up coming up with a very amicable exit plan from Varian, where I continued to work for Varian part-time until January of 17 or so, which cut down the amount of money that we needed. And then either coincidentally or not, as soon as Eric and I started working on this full-time, investor interest increased. We ended up having a venture capital firm called Safeguard Scientifics put in, I think, $250,000 into the company, which got us to our $750K. And as soon as we put out the press release that we had raised $750K, other investors came in. We ended up raising just over $1 million in that first, what would now be called pre-seed round. So I told Varian that I was leaving as soon as we had enough money in the bank to know that I could do this full time.
Nice. And how did you go about finding the investors or connecting with the funds? Did you use any specific strategy to find these investors, or?
Yeah, I think the phrase is spray and pray. I would talk to anybody who would hear about what you're building. And it turns out that, the vast majority, if not all of the initial investors in MedCrypt were not investing in the idea. They were investing in the founding team and, me and Eric and Brett and our other co-founders, because they had worked with us before.
Were they the same investors of the first company?
So Gary Kurtzman was an investor in Gamma Basics, and he, the venture fund for which he was working at the time was the venture fund that ended up putting in $250K. So he had invested previously. I also met the co-founders of a company called ThingWorks, which was an IoT platform that was based in Philadelphia, and we had some investors in common. They had sold, the founders of that company had sold ThingWorks, had been acquired, and they had done pretty well in that exit, I think. So they were individual investors in MedCrypt early on. And then essentially everybody who we met who ended up making a small investment said, oh, you should also talk to my friend so-and-so. And we ended up getting a couple of those second order investors coming in as well.
Interesting. Okay. Wow, very nice. So now transitioning to the more personal aspect of being an entrepreneur. You mentioned like the whole thing about being smarter or less smart, or that was very interesting. But there's also an aspect that is related to being more of an introvert, an extrovert. One thing that I usually find it very interesting and makes me get more interested in science-backed companies is that usually when you talk of venture building and investors and all of that, there's a lot of hype around those companies, right? And one thing that I like about science-backed companies is that the hype is usually not that the main factor. It's the science, or is the product, the solution, which was what you mentioned in the beginning. Like, I was looking at this as an experiment, and in your idea was that, well, it might work, it might not work, but I believe there is a need. So you're very focused on solving a need, which is kind of basics of any kind of company. There's no need for a company that doesn't solve a need, right? But today, what I see is so much hype, and I feel like those hype-backed companies, they serve extroverts better than introverts, perhaps, and that the science-backed field is probably better for introverts. So I think that my question is like, what do you think about that? Do you see yourself as an extrovert or an introvert after all that?
Yeah, so I'm certainly an introvert in the technical definition of introversion. So I'm not shy. I'm happy to have a conversation with anybody, and I can talk your ear off. But at the end of the day, after a long day at a conference talking to customers, I need to just go sit in my hotel room and just watch Mythbusters on Discovery Channel or something, because I'm fried. So I'm absolutely an introvert. There's this meme that I see on Twitter from time to time, which is a screenshot of Ryan Gosling and Steve Carell during the filming of, I think, Wolf of Wall Street. And Ryan Gosling is a very tall, handsome, well-dressed, slick guy, and Steve Carell's like sort of in this picture, disheveled, wearing like an untucked polo shirt and like weird sneakers. And the meme is like, this is the startup CEO and the startup CTO, and you absolutely get a bit of that dynamic, right? So if you were to talk to my co-founder Eric Pancoast, who's our CTO, and say like, hey, is Mike an introverted technologist, or is he an extroverted business guy? He would absolutely say, I'm the extroverted business guy. But it's all relative, right? If you compare me to some other entrepreneur who's really good at building hype, I'm far on the introverted, technical person scale. So I really think it's not a satisfying answer, but you need a bit of both. You need to be able to go out and talk to people and network and ask for things that are uncomfortable to ask for. And I think that those are skills that are generally associated with extroverts. But at the same time, it's definitely a thing that you get people who are really good at building hype, but maybe don't understand the underlying problem or technology as well as they could. And those companies tend to not work out well either. So you need both.
Yeah, one thing that I noticed, like I consider myself to be an introvert, more of an introvert in my second language, like in English. In Portuguese, I'm probably more extrovert, a little bit more. But one thing that I realized was that as an introvert, you have the capability of conveying more trust, I think, to whoever you're talking to, because you're more insightful. Like you think more of what you're gonna say, and when you have when you're pitching an idea, it sounds more credible. And I think, and if either like an idea to an investor, or like when you're selling your product also, it's more like it gets more technical, it gets more down to earth, and for many people that makes them feel more comfortable with you and your company, and that they can trust you. And I think that's something important too.
Yeah, I think it all depends on who you're talking to, and this relates to fundraising strategy. I know that when I first started talking to venture capitalists and investors, I had the sense that if you talk to 100 investors, they are all equally likely to get excited about the business that I'm building, and I just need to get 3 of them to say yes. But it turns out that some businesses are a really good fit for some investors and a really bad fit for others. And if your particular business or idea is not a good fit for a particular investor, there's almost nothing you can do to get them over the line, right? So I've spoken to investors who are hardcore technologists, and they themselves are scientists, and they understand the problem better than anybody else. And they probably hear my description of what we're doing and think that I'm too high level, and it's and it's marketing speak. But then I talk to other investors who are not familiar with the technology, and I sound like some technologist speaking another language. So I think it's really important that you recognize that there are good fits between certain entrepreneurs and certain ideas and certain investors and certain customers. And I've been spending a lot of time in the last 2 years, in particular, trying to spend most of my time going through doors that are open, rather than trying to open doors that are closed, right? There are some customers at MedCrypt that we would just love to work with. We've never had the opportunity, and I think one day we will. But right now, I'm really focused on maximizing the relationships that we do have. When talking to investors, 5 minutes into an investor meeting, I can tell you whether or not this is a good fit for that investor. And I really want to spend most of my time focusing on the investors for whom this is a good fit. And as a technical founder, I am much more likely to be a good fit for technical investors.
Right. And we are approaching the end of our conversation, which has been like a super great. I appreciate it so much, Mike. I think the last question I wanted to make is, you mentioned that a few times that you had an advisor, one or more advisors. So how do you see the role of advisors, coaches, mental health, even like for entrepreneurs?
Yeah, it's really important, and it plays a huge role in my job, in my day-to-day life today. Much earlier in my career, I would have told you that having a coach or a mentor sounded like some soft hippy-dippy nonsense. But starting a company has some challenges, and to your point earlier, a lot of the challenges that an entrepreneur faces are out of their control. So if you're a student and you go into a math test, you can be pretty certain that there is a right answer to the question, and given sufficient preparation, you can find the right answer. You're starting a business, there may not be a right answer to the question, and you might be asking the wrong question, and the answer may not exist yet. And there's a lot of uncertainty there. And I find that I personally struggle a lot with the amount of uncertainty that exists in the outcome of the business and the problem that we're working on. I also I read these stories about startup founders. They raised $500 million from investors, and the business doesn't work out, and they're like, oh, well, okay, I took $100 million off the table, and now I'm going to go do something else. And who knows what's happening behind the scenes? But it seems as though they're taking those failures quite well. I take our investors' dollars really, really seriously, and I want to have a good return for all of our investors and for our employees and our stakeholders. So it's there. I feel a lot of weight on my shoulders. So I have a couple of trusted advisors and investors who are the sorts of people where when things aren't going well, I want to call them. Right. So I mentioned Gary Kurtzman. He was my professor at Wharton, an investor in my first company, investor in this company. Gary reached out to me last week and said, hey, you look like you could use a pep talk. Let's find some time to talk. We had a great conversation yesterday about what's going well, what's going wrong. There are other investors on our cap table who, Tim Young from ENIAC Ventures, one of our investors. I remember after he wrote the first check, literally the next day, he said, all right, you've got my money. I can't take it back. Tell me all the things that are wrong. Like, what can I help with? It's, what a refreshing way for an investor to talk to us. And then I've worked on finding an executive coach who can help with things that maybe those investors and advisors aren't good at. And I'm currently working with someone who I really like, and I'm getting a whole lot out of it. And I really can't imagine going it alone without that support. So it's the mental health of a founder is really important. As a founder, you can't make your business successful if you're not in a good space, physically and mentally and emotionally. So I certainly encourage those entrepreneurs out there who feel like maybe they're going it alone to reach out to somebody, and whether it's an investor, an advisor, me, shoot me a message on LinkedIn. I'm happy to help. It's a really important part of success, I believe.
That's awesome, Mike. Thank you so much for coming and having this conversation. I learned a lot. It was very, very insightful, and I'm sure this is going to be helpful for many other sciencepreneurs as well.
Yeah, thanks for having me. And in summary, we need more scientist entrepreneurs, right? We need, thinking back to that meme, I would love to see more Steve Carells and fewer Ryan Goslings. So if you're a scientist thinking about entrepreneurship and have some questions, I'm happy to help or point people in the right direction.
Awesome. Thank you very much, Mike. I'm going to let you go now. I'm going to play this closing vignette here, and we'll be in touch soon again.
Great. Thanks, Daniel.
Bye-bye.